All right, hi, I'm Mark Albini. I'm going to talk to you about one of my favorite golfers of all time. Now just recently got on the senior tour, Fred Couples. Fred's been in a lot of pain over the years, a lot of back pain. And I think over the years he's probably gone to quite a few chiropractors and talked to different people about what he can do to strengthen the muscles. It's very common for golfers to have some back issues. But Doc, tell me a little bit about Fred Couples and why exactly was he in so much pain over his career?
Freddie Couples is a prime example of what I've been addressing in these earlier segments. He's had a chronic history of low back pain. His problem is not in his low back. His hips, or his femoral heads, are essentially stuck. And the ligaments attach onto your legs, they attach onto your low back. So when a rotatory swing, he tightens these up and then drags on his low back and pull torques on it, and then he has chronic back pain. Now he's had this for about 5 or 6 years, chronic, and nothing he's done has really helped that, to the point where now he's playing in tennis shoes, so he doesn't cause so much torquing by the fixation of his hips. So, you know, essentially what he needs is to have his hips released. And then when he goes to swing, he won't be torquing his low back so much to get around on the ball like he's done the previous 5 or 6 years and just suffered with this massively chronic back pain that's always afflicted him and affected his golfing. He is a great golfer, Mark.
Yeah, and I think you make a good point. Your hips getting locked, it's not necessarily a painful thing. Your hips don't really hurt, but it does cause pain to the lower back. And I think when you look at the hips in the golf swing, that's the last stop between your feet, your ankles, your toes, before you get to the upper half of your body. So a lot takes place in this range here, from the lower back muscles to the hips. I think if there were more doctors out that do what you do, that are able to adjust the hips and to adjust the groin tendons, which I think really kind of unlocks all of this and allows you to do some of the other things that you do, I think that you're going to find that almost any injury or any pain associated with the golf swing can be fixed in a very short time, and it can be done without the drugs, without the needles, and without the surgery. I would certainly try that before I ever got cut by a doctor.
Yeah, one of the things, when it comes to back surgery, low back surgery, essentially is almost 9 out of 10 people are worse 90 days post-op, where the adhesion or the scar tissue then becomes irritated by the gate mechanism, and then these people are now in more pain than they were before the operation, because the low back pain is so involved with the lower extremities, whereas neck pain is pretty localized. So, you know, if people would get into their heads that it's a system problem, not a localized problem, there would be a lot more success with low back treatment, because it's a real moneymaker. And if you go to an orthopedic surgeon or a neurosurgeon, essentially, unless you're suffering from a traumatic, car accident, or your life is in danger, low back surgery should not be your first treatment protocol to, have, because there's always going to be problems from a procedure like that, as your body then will adapt to that. And if you're an athlete, it's really going to affect the way you play, especially in a hand-eye sport like golf, or many other hand-eye type of sports activities. I mean, your body will adjust to the surgically altered area, and then you have real problems.